So you're staring at an NCLEX question. Pediatric infectious disease. What's the first thing that pops in your head? Trying to remember a million different rash patterns, right? Well, guess what? The exam is way smarter than that. It's not a memory test. It's about what you do first. It's all about if you can spot those critical signs and prioritize like a pro when things get real.
And that is the absolute key. You know, missing one of those subtle early signs, it's not just a problem for the patient. It's a direct hit to your NCLEX score. Seriously, the whole test is designed to find out one thing. Can you spot trouble before it blows up into a full-blown crisis?
Look, if you've ever felt completely swamped studying for this part of the exam, trust me, you are so not alone. Let's just get real for a second and talk about the stuff that trips everybody up, even the students who feel like they've studied everything.
You know that moment, right? That split second of panic where you're thinking, okay, is this just some simple viral rash or is it something worse? What do I do right now? That pressure to tell things apart, to see complications coming, and to just act. That's the trap. That's exactly how you end up picking the wrong answer, even when you know the textbook inside and out.
So how do you beat that anxiety? You need a system, a framework. Let's dive into a classic, an NCLEX favorite, Scarlet Fever. I'm going to show you how a solid framework can completely change the game for you.
Okay, what's so great about this? We're boiling it all down. Forget those long textbook paragraphs. We're locking in on the absolute must-know signs. I mean, why do we harp on sandpaper rash and strawberry tongue for scarlet fever? Simple, because they're unique. They're the specific clues the NCLEX gives you to separate it from all the other rashes out there. It's a pure recognition test.
And this is exactly how they test you. See? They don't care if you can name the disease. They care if you can see that whole picture. The high fever, the beefy red throat, that sandpaper rash, and instantly know your #1 priority. So what is it? Is it making them comfortable? Is it giving meds? Or is it getting them into isolation so it doesn't spread? That's the kind of clinical judgment we're talking about.
All right, let's switch gears. We're going to look at another one that loves to get mixed up with other rashes, erythema infectiosum. You probably know it as fifth disease. And this is where that pattern recognition skill is absolutely critical.
And this is where our framework really shines. What's the one thing you need to remember? That super distinct slapped cheek rash, right? By zeroing in on just that one visual, you can instantly tell it apart from that all-over sandpaper rash we saw with scarlet fever. See how that works? This is how you walk into the exam and make a choice with confidence instead of just guessing.
So you might see a question just like this on the NCLEX, but pay attention here. Notice how it shifted? Suddenly, it's not just about the kid. It's about the bigger picture. It's about safety. It's about who else is at risk, think pregnant staff members, and it's about what you need to teach the family. This is a classic NCLEX move, testing if you see the ripple effects.
Okay, last one for this preview. Let's talk about something we see all the time, but something that can go south fast. Influenza. With the flu, a quick assessment isn't just nice to have. It's everything. It's how you stop serious complications in their tracks.
Now with the flu, it's not just about one single sign, is it? It's that whole constellation of symptoms that just hits them like a truck all at once. That sudden fever, the killer body aches, that can't get out of bed fatigue. This is not just a cold. When you see that pattern, your brain should immediately scream high risk, and you should be jumping to action, thinking droplet precautions, pushing fluids.
Which leads us to a question just like this one. You see high fever, harsh cough, and then that magic key word, lethargy. Ding, ding, ding. What's your first move? The NCLEX wants to see if you can cut through all the noise and go straight back to basics. Your ABCs, airway, breathing, circulation. That's the decision that saves lives and scores points.
Okay, so we've looked at 3 different things, right? Scarlet fever, fifth disease, influenza. But here's the secret. They aren't just random facts to cram into your brain. They are all connected by a system. A way of thinking that you can use for any infectious disease question the NCLEX decides to throw your way. And this is it. This is the system. It's a simple 4-step framework that just works every single time. 1. Recognition. You spot the key sign, sandpaper, slapped cheek, sudden fatigue. 2. Prioritize. Your mind immediately goes to safety and isolation. 3. Anticipate. You're already thinking ahead, watching for what could go wrong.
And 4, respond. You make the most important move first. This is how you take that feeling of panic and turn it into a calm, confident process you can use over and over.
And at the end of the day, this is bigger than just passing an exam. This is about building the kind of solid clinical judgment that's going to make you a safe, incredible nurse. And wouldn't you know it, that's exactly what the NCLEX is trying to figure out.
So I want you to remember this. Burn it into your brain. Every single time you face a prioritization question, just ask yourself this one thing. What is the absolute safest and fastest thing I can do for this patient right this second? I promise you, that's always the highest scoring answer.
Look, at Exam Coaches, we don't do memorization. We're all about training you to think like a nurse who's been doing this for years. We're focused on spotting complications before they start, on prioritizing when the pressure is on, and on building that real-world clinical judgment that the NCLEX is actually testing.
What you saw here today, that was just a little sneak peek. The full framework, the whole system that covers tons of pediatric conditions with this exact same clarity and focus, it's all waiting for you inside the platform. It's ready to completely change how you study for the NCLEX.